Needing a heart valve replacement used to mean open heart surgery, a terrifying notion for anyone. But now doctors are doing it in a much less invasive way. Health editor Dr. Maria Simbra explains how it works and how it's helping patients recover in almost no time.
We call him Superman. He's always been our Superman. And we truly thought we were losing him.
John Lieberman had a problem with one of his heart valves, a problem that nearly cost the Superman his life.
I was sort of like out of breath at times if I went up the steps, and I would stop halfway or a third of the way and then continue on.
Aortic stenosis is when this valve, the aortic valve, becomes calcified, stiff, and tight. The heart has to work harder to pump blood out to the body, and it weakens, and you feel tired, short of breath, with swollen legs. Without any intervention, death is the usual outcome. Typically, doctors would do surgery to fix the issue, take out the old valve, and sew in a new one. Not a matter to take lightly.
Once you start operating on people that are elderly, especially around the aortic valve, you increase the risk of infections and strokes.
Doctors came up with a new way called transcatheter aortic valve replacement, or TAVR. With thin tubes and wires, they go through the blood vessels to get a new valve up to the heart.
This way, the new way, the transcatheter valve way, we don't take the valve out at all. We just actually blow a balloon up that pushes the old valve out of the way and it wedges the new valve in and starts working immediately.
At first, this technique was reserved as a last resort and for high-risk patients with lots of other health conditions that would make surgery risky. The outcome in those patients was so good, the Food and Drug Administration recently approved its use in low-risk patients.
Surprisingly, the low-risk outcomes are as good as, and sometimes in some situations even better than surgery in some patients, at least in a year.
The recovery time is amazing. The patients go home the next day or 2 days and they're back on their feet right away.
The device is made with a metal ring and cow heart valve leaflets. No one knows how long this valve will last, but best guess is 15 years, based on similarly constructed valves. So for younger patients, this would not be a good option. Also, because of how it goes in, there's a small chance of needing a pacemaker afterwards.
Less than 1% risk of dying from the procedure.
While the TAVR valve costs $11,000 more than a standard valve, the savings in operating room and hospital costs make the two approaches economically comparable. But for patients, the decreased recovery time is priceless.
We were walking the streets, doing the exercises that he's supposed to be doing, walking the streets that next day. It was amazing, truly.
Have to be some of the most grateful patients that I think we see.
I'm Dr. Maria Simbra, KDKA News.